I'm speaking with Professor Kampman. Good afternoon. We are here at the Masterclass Diet and Cancer. Can you please explain why you organized this Masterclass?
We organized this Masterclass. It's already the third time that we're doing this over a period of about 10 years. We organize it every, let's say, 5 years because we want to connect researchers, young researchers. This is a Masterclass specifically for PhD fellows, for postdocs, for young people to connect, to network, and to think about the results that they come up with in their studies, and to think about what is going to be the future. What next steps do we need to take in research? And also that's why we called it from bench to bed to behavior, also to think of how can we implement their findings into the practice, the clinical practice. What can we do with our results? So this is what we are all discussing in these 2 days that we are together, and it's very intense and very lively, I must say.
Okay, thank you. And can you maybe highlight important aspects which have been discussed?
Oh, there has been so many different things that have been discussed, but I was just thinking it comes with the M of the Masterclass. We talked about mechanisms, the underlying mechanisms, which is really difficult sometimes because it's so complex. But when we think about these mechanisms, we can think of 4 M's. We can think about the microbiota, which is becoming more and more the core of the underlying mechanism. So we talked about that. We talked about the mitochondria, the whole energy metabolism that we really have to look into much more than we're doing now. We thought about the metabolomics, all the omics methods that we now have, and how we should analyze these, how we should interpret these findings. We talked about the M from Mendelian randomization and mediation analyses, and how we can help improve these statistical methods. And what's really interesting in this Masterclass is trying to integrate the animal studies with the epidemiological evidence. So that's why we're together with people in the really fundamental part of our research, as well as in the more observational part, to sort of connect and then think about the underlying mechanisms connecting diet, nutrition with cancer. That's really the highlight of the first day. And then, if I may, the highlight of the second day, I think it's the C from Masterclass. The C for communication, the C of connecting, and how do we now communicate? How do we change behavior in the healthy population, but also among those who already got cancer? How do we change into the behavior that we really would like to see? We have these very nice cancer prevention recommendations, but how do we get them across to the public? That's something we discussed in this second day, and I'm really looking forward to whether we can indeed change these behaviors, and not only in the Western world, but it's also very important to change behavior and change policy and change politics in the low and middle income countries, because there we see an enormous rise in the incidence of Western types of cancer.
Yeah. And then lastly, what is the role of the newly published WCRF recommendations for this?
They are at the heart, they are at the core. I think it's a tremendous amount of work that WCRF and the ICR did with getting all these data together, and then have these researchers and expert panel translating all the results into these recommendations. And we also saw in this Masterclass that if people adhere to these recommendations, they are indeed decreasing their cancer risk, and several types of cancers are decreased when people can adhere more. But it's the question of how to adhere to these recommendations, which is now central. How should we do that? And so we should now also invite, we have these epidemiologists and animal research people, biochemists, but we should invite the psychologists and the sociologists and the policymakers, the communication experts, on how we get that message across.
Okay, thank you. There's a lot of work to do still.
Yes.
But it was an inspiring event.
Thank you.
Thank you.